Hi everyone, this is Harshita. So today in this class we are going to discuss adenocarcinoma of lungs in respiratory system of pathology. So this is the most common lung carcinoma mostly seen in the women's. Okay, and this is seen in non-smokers. In the last class I told about the squamous cell carcinoma, and in this I discussed many points. If you not seen the video, please go back and watch the video first. In squamous cell carcinoma and small cell carcinoma, as they are starting with S, they are strongly associated with the smoking. In adenocarcinoma, they are non-smokers also getting affected due to this. And if this is lung, the lung mostly present in the periphery of the lung. So it is periphery located. And paraneoplastic association is migratory thrombophlebitis. So this is seen in the adenocarcinoma of lung. And the genetics. In squamous cell carcinoma, the genetics affected are chromosome 3p, 9p and 17p, and also RB gene, P53 gene are getting affected, whereas in adenocarcinoma, they are EGFR gene, ALK gene, METM gene, KRAS and RET, red gene are also getting affected. To remember this is the hint I am giving you. Ear met KRAS, ear met KRAS. So MET is the gene, KRAS is also gene, ear. E for EGFR, GFR, you know it, right? Glomerular filtration rate. So EGFR, this is the hint that you can remember in adenocarcinoma of lung. And the precursion lesions are very important. Here the precursion lesions are atypical adenomatous hyperplasia and adenocarcinoma in situ. So let's discuss them one by one. Atypical adenomatous hyperplasia. So these are the lesions of below 5 millimeters. Okay. So this is the alveolar epithelium. Here you can find dysplastic pneumocytes. So pneumocytes are dysplastic. There is no maturation in the, or there is no production in the pneumocytes. Hence this is called as atypical adenomatter hyperplasia. Hyperplasia means increase in the number of cells. Okay, the cells are getting increased, but what types of cells are increased? Dysplastic cells means you can remember it like defected cells. Next one is adenocarcinoma in situ. This adenocarcinoma in situ, it is bronchoalveolar carcinoma which is less than 3 centimeters. And here the important feature one should remember is, here butterflies on the fence appearance can be seen. This is the epithelium, and lining the epithelium, these are the tumors. So tumor cells are growing along the bronchoalveolar lining. This is the bronchoalveolar lining. These are the tumor cells. Because of this presence, it butterfly appearance on the fence, and this is filigree pattern or lipidic pattern. Next one is identification features. If we do H&E staining, you can observe this is the gland. So this is the gland. Lining the gland, there are malignant cells. Malignant cells are lining the gland. So this is the first one. So this is the example. There are also types in this. We are having well differentiated, moderately differentiated and poorly differentiated. In squamous cell carcinoma, in poorly differentiated, we can observe it by cytokeratin, P53, P63 and P40 markers. Here we can observe these by TTF1 gene and napsin A. So these are the identification features. So this is all for adenocarcinoma of lung. So very easy. We discussed the introduction part and pathogenesis like genes affected and paraneoplastic syndromes, and lastly identification features. So this is all for today. If you're not subscribed to the channel, please consider subscribing to the channel. Teddy gets you, and please do watch all the videos that are related to the respiratory system. They are very easy and very mnemonic, and please don't forget to share this video to your friends. This is Harshita signing off. Thank you so much.